Let's talk about antenatal surveillance. So what are some of the antenatal surveillance techniques? One is kick count. You have the patient lie on the side. They should count 10 movements within 2 hours. And most patients will feel it within 1 hour. This has not shown to have any benefit, but can increase preterm labor or C-section rate. Contraction stress test. Okay, so what are the techniques? One is the kick count. One is contraction stress test. One is NST. Number 4 is BPP. Number 5 modified BPP, and number 6 is UA Doppler. So for kick count, we talked about it earlier. Contraction stress test, 3 contractions on at least 40 seconds within 10 minutes. So you want 3 contractions, at least 40 seconds each within a 10-minute period. Can be induced with Pitocin or nipple stimulation. It's positive if 50% of contractions cause late D cells. NST, vibroacoustic stimulation can be used up to 3 times for up to 3 seconds. We want to see a 15 by 15 acceleration for ages 32 weeks and more. Before 32 weeks is 10 by 10. Recurrent variable D cells 3 times in 20 minutes is associated with increased C-section rate. D cell greater than 1 minute is associated with fetal demise. BPP. NST can be omitted if all other components are normal. Breathing, 1 episode of 30-second rhythmic breathing movement in 30 minutes. Movement, 3 discrete body movements. Fetal tone flexion or extension that return to their original position, or hand opening or closing. Fluids, MVP greater than 2 centimeter. Modified BPP is NST for short-term acid-base status. Look at the fluid for long-term placental function. UA Doppler, this is for FGR evaluation. Rate of stillbirth after 1 week of normal surveillance for NST is 2 out of 1,000. For stress test is contraction stress test is 0.3 out of 1,000. For BPP or modified BPP is 0.8 out of 1,000. Starting at 32 weeks, who should get antenatal surveillance starting at 32 weeks unless early delivery is expected? So patients with FGR, they should get weekly Doppler and BPP growth every 3 to 4 weeks. If the patient reports decreased fetal movement, we should evaluate with NST followed by BPP if abnormal NST. A BPP of 6 out of 10 is equivocal. If you're already term at 37 weeks, you should deliver. If less than 37 weeks, we repeat the BPP in 24 hours. If the BPP is 4 out of 10, we should deliver if there are 32 plus weeks. Oligohydramnios should deliver between 36 and 38 weeks. So 6 out of 10 BPP is equivocal, and if they're already term, they should be delivered. If they're less than term, we repeat the BPP in 24 hours. If the BPP is 4 out of 10, that's bad, and they should deliver if they're over 32 weeks.